In this video, I'll be demonstrating how to feed a dependent patient. Feeding patients that are not capable of doing so themselves are part of the responsibilities as a nurse. But first, there are some tips we should take note from. First, always get the food from the dietary canteen. Second, make sure the patient does not feel pressured when eating. Third, check the diet with the dietary card and make sure that the diet goes along with the food ordered. Do not blow over the patient's food. To check the temperature of the liquid substances like all the beverages, you can put a little on your wrist to check the temperature at first. Let the patient handle their food to the best of their abilities. And lastly, take careful observation of swallowing of food. Now for the demonstration, you walk up to the patient and tell the patient it's time for lunch and if she's prepared to have her lunch now. Then you go and get the meal for her. Now you are back with the lunch meal. You say what the patient requested for. In this video, she requested for some rice and beef stew and plantain at the side, and she also got some juice and of course water. So now you place it on the table, and now we will wash and sanitize our hands for the meal. With my hands washed and sanitized, I will help the patient to eat a meal. First, you help the patient to sit properly and comfortably to eat the meal. You can ask the patient if they are capable of moving their legs themselves. If so, then they can do it. If not, you help them to sit properly, move their legs to eat their meal. So first, always sit at eye level with the patient when serving the patient. And we are supposed to use an overbed table, but we are going to use this as a substitute for it. Then put the napkin on the patient carefully and comfortably. Then you ask the patient what her preferences are to eat first, if she would like to take the water first. So she would like to take the water first. So you serve her water in sips. Right now, she would like to take the meal. So take the spoon and begin to serve her some food. Carefully and gently lifting it to her mouth while wiping off any excess food that could have dropped. Use your right hand or your dominant hand to feed the patient and be at right angle to the patient, making sure she is very comfortable. Ask her if she's satisfied, and if she is, then you clear the meal. She is done with her meal now and she is satisfied. So we take off the napkin off her shoulders and chest, fold it and put it somewhere. Then after a few minutes of eating with no complications and problems, you lay her properly back on the bed, making sure she is well comfortable. The patient has been able to eat her food without any problems, and she had over 75% of the food. So we record this into the chart sheet and dispose the rest.